This conference is being recorded. Cette conférence est enregistrée.
Bonjour à tous. Bienvenue. Hello. This press conference is in the Sir John A. Macdonald Building in Ottawa. It is Thursday, January 27th. I'm Greg Quinn with Market News International. With us today for this update on COVID in Indigenous communities are the Honourable Patty Hajdu, Minister of Indigenous Services, Dr. Evan Adams, Deputy Chief Medical Officer of Public Health, Patrick Boucher, Senior Assistant Deputy Minister of the First Nations and Inuit Health Branch. Alors avec nous aujourd'hui, l'Honorable Patty Hajdu, Ministre des Services aux Autochtones, Dr. Evan Adams, médecin en chef adjoint de la santé publique, et Patrick Boucher, sous-ministre adjoint principal de la Direction générale de la santé des Premières Nations et des Inuits. Before we start, I will remind everyone to stick to best practices to minimize outside noise. Secondly, the Minister is due to leave at 3 p.m. sharp. Last, please identify yourself and your media outlet when asking a question. I've been told we now have until 3:05 with the Minister. Ministre Hajdu va partir à 3h05 et s'il vous plaît, les journalistes sont invités à utiliser un micro ou, si possible, un téléphone fixe et à éviter d'utiliser le mode haut-parleur si posant des questions. That said, let's begin with some opening statements and then questions and follow-ups, please. Minister, please begin.
Thank you very much, Kwekwe, Uluku, Tansi, hello, bonjour. I'm here today on the traditional territory of the Fort William First Nation, which is within the Robinson Superior Treaty Territory area, and of course, many contributions by Métis people over the generations. And thank you again for joining us this week. I am joined by Dr. Adams, who's the Deputy Chief Medical Officer of Public Health, and Patrick Boucher, Senior Assistant Deputy Minister of the First Nations and Inuit Health Branch. We'll provide a brief update and then we'll be available for questions. First, I want to acknowledge the profoundly sad news shared early this week by Williams Lake First Nation. Our thoughts are with the community and, of course, everyone who's been affected by this very, very difficult finding. As my colleague, Minister Miller, has said many times, the horrific acts committed in residential schools are not news to Indigenous peoples. As we acknowledge the ongoing discovery and these shameful truths as part of our history, we remain committed to supporting those who have suffered, listen to leadership and survivors, and supporting the difficult work of finding and commemorating those missing children. If you are a residential school survivor or you know someone who is in need of crisis services, please let them know that help is available through the National Crisis Line at 1-866-925-4419. Yesterday, I was pleased to share alongside my colleagues, Minister Miller and Minister Lametti, that the federal government has now withdrawn its judicial review before the federal court regarding the Canadian Human Rights Tribunal order on funding for capital assets as it relates to First Nations Child and Family Services and Jordan's Principal Services. I want to thank all of the parties at the table that have been working so hard together so that we have a common understanding of the orders and we can agree to that common understanding. As I've said many times, litigation is in no one's interest. And so this is a positive step forward. It's one more piece removed from court processes that helps us remain focused on implementing the long-term reforms and the supports that truly will change the reality for so many Indigenous First Nations children and their families. Today on COVID, we have a little bit of space for cautious optimism this week. The number of active outbreaks in Indigenous communities is decreasing slightly. Active cases counts, we are hopeful, are reaching their peak. And I know that so many people are exhausted and have been working so hard to protect each other. I sincerely hope we're starting to shift to the backside of this most recent wave. But it is a reminder that we all have to stay vigilant and keep doing what we're doing, protecting each other, protecting our own health, protecting our communities, stepping up to help each other, and of course, taking care of each other in this really challenging time. Vaccines continue to show us that they are one of the most effective tools to preventing serious health outcomes and deaths. So please continue to book your next shots or boosters if it's your time and you haven't already done so. And for people in your circles and your families, continue to have those important conversations about how vaccines can reduce risk of death, reduce risk of hospitalization, keep families intact. For First Nations and Inuit, if travel is needed for vaccination, it will be covered by the non-insured health benefits. Le nombre d'éclosions actives dans la collectivité autochtone diminue légèrement et nous espérons que le nombre de cas actifs atteindra son sommet. J'ai bon espoir, comme bien d'autres, j'en suis sûre, que nous allons peut-être commencer à tourner la page sur cette récente vague. Cependant, nous devons tous rester vigilants et continuer de faire ce que nous faisons, protéger notre propre santé, la santé de ceux que nous entourons, nos communautés et nos systèmes de soins de santé. Les vaccins continuent de nous montrer qu'ils sont l'un des outils les plus efficaces pour prévenir les conséquences graves pour la santé et les décès. Alors, si vous ne l'avez pas déjà fait, veuillez continuer de prendre rendez-vous pour vos prochains vaccins ou vos vaccins de rappel. Dans le cas de Premières Nations et des Inuits, si des déplacements sont nécessaires pour la vaccination, ils seront couverts par les services de santé non assurés. And as we've provided updates in recent weeks, we continue to work directly with communities to help prepare for and respond to outbreaks. More detail is available in our accompanying news release for this week's update, but I do want to point out some of the great work being done with partners across the country, including a new app that's being developed by the Federation of Sovereign Indigenous Nations, FSIN, to help build vaccine confidence. The Talking Stick app, which is expected to launch in the next month or so, is an innovative, Indigenous-led app that will provide a platform for First Nations to ask questions about COVID-19 and vaccines. In Alberta, Indigenous Services has been supporting mental wellness town halls on Windspeaker Radio to feature advice from medical officers of health, mental health support workers, guidance from elders, and more. The Assembly of Manitoba Chiefs has an ambassador initiative that Indigenous Services is partnering with on to provide Indigenous teams of 8 to 10 people who can provide immediate resource support to First Nations communities in their COVID response. And in six nations of the Grand River, some great and innovative community programs have been happening. This has included a mobile bus vaccination clinic, drive-through events to distribute rapid tests and masks, call-in radio shows with medical experts, and recording podcasts with local community members about vaccine hesitancy. These are just some of the great examples from communities across the country doing their part, thinking outside of the box. And I want to thank everyone for doing that together, putting together innovative solutions and programs, keeping each other safe. It's still a very challenging time for everyone, but I do hope that we'll see more optimism in the weeks ahead. And I want to thank everyone that has been helping each other, stepping up to be there for each other. This is how we get through this, by supporting each other in these weeks ahead. Thank you very much. I'll turn it over now to Dr. Adams, Deputy Chief Medical Officer of Public Health.
Great, thank you very much, Minister. Ajishwood, I want to acknowledge that I'm speaking to you from the unceded territory of Tla'amin Nation, my home nation. As of January 25th, 2 days ago, over 1 million doses, or 1.05 million to be exact, have been administered in First Nations, Inuit, and territorial communities. Of those, over 86% of individuals aged 12 plus have received a second dose. Less than 20% of adults have received a booster dose, and over 43% of individuals aged 5 to 11 have received at least one dose. As of January 26th, there are 5,509 active cases in First Nations communities, and sadly, there have been a total of 599 fatalities due to COVID-19 since the beginning of the pandemic. Indigenous Services Canada continues to work with other federal departments, provinces, territories, and Indigenous partners to provide supports in responding to the pandemic where possible. Following public health measures remains essential in getting through this Omicron wave. An additional step that can be taken is to consider the regional context on top of provincial and territorial public health measures as local epidemiology changes quickly. Vaccines continue to play a critical role in reducing the risk of serious outcomes, such as hospitalization and admission into the ICU. Receiving the vaccine, whether that be the first or second dose for unvaccinated individuals or a booster dose when eligible, helps to protect family, friends, and communities. Although no single public health measure is 100% effective at preventing COVID-19, we encourage everyone to take a layered approach to help reduce the spread. This means layering the protection provided by getting a complete series of a COVID-19 vaccination with timed and targeted public health measures, and individual protective practices such as staying home and or self-isolating if you have symptoms, wearing masks, social distancing, etc. COVID-19 has limited our ability to spend time with loved ones, establish and maintain meaningful connections, as well as travel and the ability to partake in cultural gatherings. This has had a profound impact on the mental health of some, including our communities and our workforces. It is important to reach out to your loved ones and to those at risk, as well as lean on one another for support during these very difficult times. Everyone has a role to play in getting through this current Omicron wave, and our individual actions collectively have a large impact. Let us continue to work together to move forward. Iimut, nakumek, Marcy, thank you, merci.
Are we ready to move to questions?
Yes, we are.
Yes, okay, thank you. Operator, can we have the first question from the phone, please? Première question, s'il vous plaît.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Dylan Robertson, Winnipeg Free Press. Please go ahead. À vous la parole.
Hi there. Thanks for holding these briefings. A question for Dr. Adams. What do you think is driving the lag in booster shots? Is this just pandemic fatigue or perceived lesser risk, or is it more of a logistical factor because the first 2 doses were part of the mass, deployment with the military involved?
I think there are probably a few factors that are affecting the slight lag in booster uptake. Part of it is that we have some younger populations who are slower to get to the booster simply because of the recommendations from NACI, and because a large part of our focus at the beginning was on older populations where there is more risk. I think as well, there's definitely some fatigue amongst some of our populations. I think that they've been dealing with this for a long time, and that perhaps it is a lot of information for them to take in, that a 3rd dose has become an eventuality. But I think that our uptake for first, second, and 3rd doses has been good, but there's always room for improvement. I think I'll stop there. Thanks.
Thank you. And I'd also like to ask Minister Haidu about the distribution of Paxlovid. Last week, you probably heard me ask Dr. Wong about what amount Indigenous Services Canada was getting. I just wanted to ask if you think it's fair to have it on a per capita basis. and if you plan to ask for more, just given the heightened vulnerability, the more severe outcomes that we're seeing in multiple provinces for Indigenous people.
Sorry for the pause there, trying to get myself unmuted. I will turn to either Dr. Adams or Patrick Boucher in a moment, but I will just say this. Obviously, many Indigenous people are treated in provincial healthcare systems where they would also have access to Paxlovid. So perhaps I can turn to Patrick Boucher to talk about the distribution of the medication and how, in particular, it might be used in the context of that we've received that medication.
Absolutely, thank you, Minister, and thank you for the question. And just to start off by saying that, we continue to work with provinces and territories as very important partners to allocate the supply equitably across jurisdictions and different segments of the population. And that collaboration and that continued work together is absolutely essential as we go down this path with these antivirals. I will say that allocation principles and interim implementation criteria have been considered in determining the current allocation to remote and isolated First Nation communities in order to optimize the limited supply, and the department will continue to work with partners in determining how best to manage the allocation as available supply increases in the weeks and in months to come. So the department has received their initial allocation of Paxlovid, and we're beginning to ship those very precious resources to remote and isolated communities this week to pre-position communities with these treatments. But I'll turn to Dr. Adams to see if he has anything to add on that.
We work very hard to make sure that we have these backup medications. I think, of course, being fully vaccinated and being boosted where eligible are the best chance that we have. And even though Omicron hasn't been giving us as serious outcomes as Delta, of course, giving us higher volumes. The availability of antiviral medication is a good backup, particularly in remote areas where they may not have the same kinds of tertiary care that happens in urban centers. I feel like we've worked really hard to make sure that those backups are in place as quickly as possible, should they ever be needed, as well as making sure that we have other kinds of care. I don't think of any of these medications as a magic bullet. It just adds to our toolbox in taking care of populations.
Thank you, Dylan. Operator, next question, please.
Thank you. Merci. Once again, please press star 1 if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. The next question is from, la prochaine question est de Laura Osman, the Canadian Press. Please go ahead. À vous la parole.
Good afternoon. I wanted to follow up on the rate of people on First Nations who are boosted. You talked a little bit about some of perhaps the vaccine hesitancy, the fatigue, but I'm wondering if access has been a concern or if anything has changed since the initial rollout of the first 2 doses of vaccines on First Nations.
Maybe I can turn to Dr. Adams for the question.
Well, it certainly has been a challenge for us to make sure that the vaccine supply and distribution has been fair and equitable and timely. I certainly don't think of access to vaccine as being much of a factor at all, actually, in third doses for those who are eligible. I would say that definitely we do need to keep speaking to populations that might be hesitating. It's a part of the work. It's definitely a part of the work that personally I find a bit painful because I definitely know that getting a third dose is the best chance that we can give our populations. And definitely I have been urging our populations to be kind to each other, whether they're vaccinated or not, whether they have 1 dose, 2 doses, or 3 doses, wherever they're at in their vaccinations, we look after each other. Thanks.
Thank you. I just also wanted to ask about any support for First Nations, given that we are at the peak. Is anyone still requesting help, and are you sort of marshaling any support in anticipation of sort of the downward edge of this curve?
Maybe I can start and then turn to Patrick for a few details. Yes, we're still supporting a number of communities with a number of different assets, whether it's people or resources, as requested and as needed, and certainly announced, as you know, last week, additional monies directly available to First Nations and Indigenous communities that are underway right now, that are being distributed directly to communities, so they can continue their hard work of protecting community members in whatever way that is most effective. And often they, on the ground level, know exactly how best to continue that protection. But maybe, Patrick, you can speak about some of the communities that are receiving additional supports, or the kinds of supports that we're still providing.
Absolutely, Minister. And you know, as the Minister said, you know, the top priority continues to be the health and safety of First Nations, Inuit, and Métis peoples across the country. And we're committed to supporting communities in their response to COVID-19, making sure that they're culturally appropriate responses, community-driven responses to COVID-19. And doing that in partnership with Indigenous leadership and organizations, and provincial and territorial governments as well, and many other system partners that we work with on a day in, day out basis. You know, the public health advice and guidance related to COVID, as we all know, changes depending on the variants, depending on where the pandemic is going. So we need to make sure that we're nimble in supporting communities, no matter what the need is, whether it's with vaccination clinics, whether it's with you know, HHR, human health resource support, whether it's just with humanitarian supports when community members are isolating within community to protect their most vulnerable. And now, you know, also we're seeing that continued support and the needs related to mental wellness and mental health. So making sure that we're taking a holistic approach to supporting communities, being there for communities, having them in the driver's seat and identifying what those gaps are and what those needs are, but then very quickly being there to support them, to partner with them, to make sure that they get the supports that they need. Thank you.
Thank you, Laura. Let's go to the next question, and I will note I've been told that the Minister could be with us now until 3:15, 15:15. Thank you for that. Operator, next question, prochaine question.
There are no further questions registered at this time. Nous n'avons plus de questions pour le moment.
Would I be able to put one in as moderator, Minister? Since we're ahead of schedule.
Yes, sorry.
Okay.
Go ahead.
Thank you.
Of course.
Many Indigenous people don't live in remote communities, but they live downtown in major cities, and they can often be hard to reach. Are there any special considerations in providing health care to people who are living in those situations?
Well, thank you for the question. It's a pretty broad one. And I will just say, yes, there are a number of partnerships across the country with Indigenous healthcare providers, and indeed, including in British Columbia, that has a First Nations Health Authority. In terms of vaccination, with the vaccine challenge that has just been announced, a number of the recipients of funding to provide additional awareness and new tools to reach people about the importance of vaccination and getting vaccines to people were Indigenous organizations, were Indigenous community supports. And so, we work obviously in collaboration with provinces and territories and municipalities to support them in their jurisdictional obligations to provide healthcare in an equitable way, but realizing that there are barriers for First Nations Indigenous people in big cities. And so that's a focus that remains a very strong one for us.
Thank you. With that, I'd like to just put out one last call. Are there any further questions on the phone line?
There is one question. Nous avons une question. The question is from, la prochaine question est de Laura Osmond, the Canadian Press. Please go ahead. À vous la parole.
Hey there. Sorry to sneak one more in. I just wanted to ask you exactly how many communities you are still in at the moment offering additional support for COVID.
I don't have that number, Patrick. Perhaps you do.
Well, just to say, I mean, it's a very broad question. Throughout the country, our regional officers of health, our regional offices are in constant communications with communities, no matter what province or territory we're talking about. So there are those, ongoing conversations. I don't have an exact number for you, but just to say that it is continuous, depending on the needs that come up, and we just want to make sure that we continue to be there for those communities when they do call, when they do need support to address their COVID needs within their community. So I don't have a specific number to give you, but just to say that it's pretty much across all communities where we have that continuous engagement to make sure that gaps are being filled.
All right, thank you.
Once again, operator, could we check to see if there are any remaining questions?
Yes, the next question is from, la prochaine question est de Dylan Robertson, Winnipeg Free Press. Please go ahead, à vous la parole.
Hi, I'm also going to sneak one in here for Minister Hajdu, just a general sort of question about housing. I just wanted to follow up because I know that you said you were going to look into making the national housing strategy work better for Indigenous populations. Could you just give us a bit of an update on where things stand, what we might expect as a timeline to hear more about that, and maybe some of the themes that you're looking at?
Oh, well, thank you, Dylan. And in terms of specifics, I really can't talk today too much about that, other than to say that this is a priority that has been raised by almost every Indigenous leader I've spoken to since I've been the minister. And in fact, as we know, housing is a social determinant of health. What that means is without good housing, it's very hard to, for example, protect yourself against COVID-19, to treat tuberculosis, to prevent and protect other kinds of illnesses. In fact, here in Northern Ontario just released a report about the detrimental effects of poor housing on the health of Indigenous children and their families. So clearly this is a priority for every leader that I've spoken to across the country. And so, we've obviously committed as a government with a significant investment in renewal of infrastructure and closing the infrastructure gaps on First Nations communities. But I will say that a priority for me is housing. I have certainly stressed that with my colleagues at the cabinet table about the need to be ambitious and bold in the way that we invest in housing on First Nations in partnership with First Nations and Indigenous leaders. This isn't a solution, this isn't a problem that can be solved solely by the federal government. Obviously, Indigenous communities have a huge role to play in terms of community planning and infrastructure planning. Oftentimes adding more housing means adding essentially effectively another subdivision, which means additional demands on water and other kinds of infrastructure. But I will tell you that across the country, what chiefs and leaders have been telling me is that even despite those challenges, there's room for much more rapid work in affordable and decent housing on First Nations all across the country.
Thank you, operator. Are there any questions of someone we haven't heard from on the line?
There are no further questions registered at this time. Nous n'avons plus de questions pour le moment.
All right. I always like to ask if Minister or any of our doctors would like to have any closing thoughts or comments for us before we close out.
Just thank you for being here. Thank you for showing interest in Indigenous people in this country. It's very, very important that we continue to keep our eye focused on folks that oftentimes through systemic exclusion have some of the biggest challenges in staying healthy. So this is very important that you're covering these stories. Thank you.
Thank you very much. That appears to be all we have for today. Thank you. Merci, miigwech. Bonne journée.
Thank you. Merci. The conference has now ended. La conférence est maintenant terminée.